that. And so important to make sure young people are heard in all decision making.
Indeed, De Graft. We've still got 2 more great course sessions coming. There is Investing in Tomorrow, Empowering the Next Generation. Has a focus on young professionals because they're so vital to bridge the gap between adolescents and health experts. Or you can join Elevating Future, strategy for education for health and well-being, which is being hosted by the African Union Commission and marks an incredibly historic moment for Africa's adolescents and young people, with over 60% of the continent comprising of young people.
And there's loads of exciting content with voices of young people from all around the world. So stay tuned and see you after the next sessions.
I was born and raised in a community that 98% of girls of my age have gone through the cut, but I didn't go through the cut because first, my mom was not from that culture. Second, my dad was someone who was so vocal and an advocate for the act, so I was protected. But I went through a lot of stigma because I wanted to identify with the community and to feel like any other young girl in my community, because you find out that during holidays they used to say how they went through the cut, how amazing the process was, how they are now complete woman, they can identify, you have that sense of the community and you want to be part of that community. But I realized when I now had sense in my head, I was like, okay, it was good I didn't went through the cut, and I thank God I didn't. And I started now speaking up, like why I didn't go through the cut, to also show other any young girl in community, like it's okay for you not to go through the cut, like you're still a woman. But when I was their age, I didn't even used to say I didn't go through the cut, because stigma, you'll be seen as an unclean, you're not a woman, but now I didn't go through the cut, and it's so amazing. Yeah, I'm so protected, So you need to speak out for yourself, and you need to have a voice as a young woman. Duty bearers need to be responsible with their roles. Like, we have the laws, we have the policies that are there, but we're not taking any action. So we need to take action as government. If the communities are doing it, why don't you take action on that person? Why don't you let them be the example to others? If we take action, then everything, we will not be talking about FGM, we will not be singing this song. I guess this is a song, and we are tired of singing this song every other day, every other month, every other year, like FGM. But we need to take action. We need to be responsible as community, and we need to report to ensure that we protect our girls.
The future belongs to the skilled generation, a generation that learns by doing. Only skilled young people are ready to face the world and the future. That future starts today. It starts now. Introducing FANDU, an initiative of UNICEF Uganda on your report to bring real-world life skills and help young people like you excel in your school, career, and beyond. Meet your new fun friend who will help you build 21st century skills, your career, study well, and do much more. You will be more self-aware, be able to solve problems, become a better communicator, and will feel more confident about your employment prospects. So, what are you waiting for? Get started and do exciting activities with FANDU. To join FANDU, send the word FANDU to your report on SMS 8500 or WhatsApp number 0709 168 500 or Facebook Messenger, your report Uganda Kampala Facebook, or visit our website on www.ureport.ug/select FANDU and start your fun adventure. FANDU, train for life, one task at a time. FANDU is brought to you by UNICEF Uganda.
Como assim, Isabela, um caminho? Um caminho cheio de oportunidades, para que eles consigam, enfim, colocar em prática o sonho. Hoje, a gente vê crianças e adolescentes que deixam de sonhar porque acham que não é possível eles chegarem lá. Meninas, meninos negros, meninas trans. Então, eu acredito que um futuro melhor é um futuro com esses jovens podendo serem quem são, sem discriminação de gênero, de raça, de renda, de deficiência, apenas seguindo o que eles acreditam e seguindo o sonho deles.
Hi, I am Saidu, courtesy of Youth Partnership for Peace and Development. I am serving as one of the mobilizers for the 1.8 billion Young People for Change campaign. I join hands with Global Forum for Adolescents in making the clarion call for governments and partners to invest into the lives of young people.
हेल्थ से रिलेटेड मुझे लगता है कि वो बहुत अच्छी रूटीन होनी चाहिए और एजुकेशन सिस्टम में हेल्थ के रिगार्डिंग कोई इन्फॉर्मेशन दी जानी चाहिए.
Richard and the partnership advisor for YPPD, and we live in a world where we are told we are the leaders of tomorrow, and those charged with the responsibility to man our affairs have sworn that tomorrow never comes. Let us today tell these people that the tomorrow they have been talking about is today. As youth, we should stand up and use our golden voice in sending a loud and clear call on things that affect our personal development, which includes our well-being. So in this light, I want to introduce to you the 1.8 billion campaign, which actually gives us the legitimacy as youth to stand up for our well-being. Thank you so much.
I'm Christine and I'm from Sierra Leone. The well-being of adolescents and young people should be invested for a better world for tomorrow. Thank you.
और मेरे गांव में कंप्यूटर क्लास नहीं है, वही क्लास कंप्यूटर क्लास चालू होना चाहिए सरकारी से.
मेरा नाम मुस्कान कुमारी है, मेरे पिताजी का नाम रंजित राजवंशी है. मैं इस गांव की निवासी हूँ. मैं कंप्यूटर क्लास के लिए सरकार से मांग करती हूँ कि कंप्यूटर क्लास के लिए इस गांव में व्यवस्था किया जाए.
The International Federation of Medical Students Association recognized the importance of prioritizing adolescents' health on multiple fronts. Adolescence is a critical period for physical, emotional, and social development that sets the foundation for future health and well-being and has long-lasting benefits on individuals and society as a whole.
Medical students worldwide calls on government to improve service delivery, enact supportive laws and policies, and increase funding to address the unique needs. Adolescent health has to become a political and financial priority of member states so that young people can exercise their right to health.
We call upon health systems to address key issues affecting adolescents, including climate change, mental health, sexual and reproductive health, and non-communicable diseases, taking into account the diverse experiences of young people and the heightened barriers faced by adolescents from left-behind populations.
Medical schools to integrate adolescent health into medical curriculum, bridging the knowledge and research gap. A survey we conducted showed that medical students from 85 countries feel least confident managing adolescent health.
Lack of data is seen as one of the obstacles in providing adolescents with quality care. Therefore, we need to address the disparities in medical research and education in regard to including adolescent-focused content.
Medical students will support the 1.8 billion campaign to mobilize collective action to meet adolescents' health and well-being needs, and to work toward a healthier future for all young people.
In order to be a key stakeholder to improve adolescent health and well-being, I want to be part of a multidisciplinary global network of clinicians, researchers, and policy experts united by a shared passion and commitment. I also want continuous engagement with the adolescent community to better understand their evolving needs and challenges, as well to foster a strong foundation of trust and collaboration between young professionals and the youth that we serve.
In order to be key stakeholders to improve adolescent health and well-being, I would want increased leadership opportunities for young professionals to create sustainable and equitable health outcomes.
In order to be key stakeholders to improve adolescent health and well-being, I would want governments and health systems to invest in making adolescent health and well-being a priority area for action.
In order to be key stakeholders to improve adolescent health and well-being, I would want to develop effective communication and leadership skills to work with adolescents and ensure their voices are heard.
As a healthcare worker working with adolescents, I'd like to get information in the area of adolescent health from those that are way ahead of me. I mean key experts that have more years of experience in the sector. I also like to work with people that are in the government sector and also those in the academia so as to get up-to-date information in the area of adolescent health, because information is power. Through this medium, I'll be able to impact the adolescents I'm working with. We live in a world of collaboration. I like to have access to mentoring and collaboration with key experts in the development world.
To ensure I can act as a key stakeholder to young people to promote good health and well-being, I would want better training opportunities to enhance my skills such as communication, facilitation, and cultural competency. To ensure I can act as a key stakeholder for young people to promote good health and well-being, I would want mentorship programs to guide me in my career and learning development.
In order to be a key stakeholder to improve adolescent health, I would want a comprehensive support for mental health and self-care, recognizing the importance of well-being in our field.
Hello everyone, my name is Stephanie Partridge and I'm one of the 4 co-chairs of the International Association for Adolescent Health Emerging Professionals Network. Today I'm joining you from the beautiful lands of the Gadigal people of the Eora Nation from the University of Sydney in Australia. I'd like to pay my respects to the traditional owners of these lands and pay my respects to elders past, present and emerging. Welcome to our virtual session on investing in tomorrow, empowering the next generation of adolescent health professionals. Today is about recognising and addressing the challenges that we face in our training and in our careers. Our role, our passion and our dedication cannot be underestimated in improving adolescent health and well-being worldwide. While we bring fresh perspectives, energy and innovative ideas, many of our colleagues are grappling with issues like burnout, lack of training and inequitable access to resources. We are joined today by colleagues from the Youth Care Professional Association, the World Association of Trainees in Obstetrics and Gynecology, the International Confederation of Midwives, the West African Institute of Public Health, and the Innovation and Access Development Initiative. Each will shed light on these challenges and propose recommendations. Our goal today is not only to highlight these issues, but also to emphasise the importance of young professionals' unique experiences. Let us dive deep, learn, collaborate, and pave the way for young professionals to emerge as the future leaders in the multidisciplinary field supporting adolescent health and well-being. So right now, polls will be open and we encourage you to tell us, to engage and tell us what you think. We'll then discuss these poll results in our live discussion later in the session. Thank you.
As the co-chairs of the Emerging Professionals Network of the International Association for Adolescent Health, we are advocating for the key role young professionals play in enhancing adolescent health and well-being globally.
Firstly, understanding the context. The world has begun recognising that supporting adolescents isn't just about their present well-being, but it's also about their future as adults and the wellness of the generation they will raise. It has been coined the triple dividend or triple benefit. This recognition has sparked global campaigns and forums like this one focused on advancing adolescent well-being and health.
Now, where do young professionals fit into this picture? Well, the International Association for Adolescent Health has an emerging professionals network. It's a global community comprising of young healthcare providers, scientists and advocates who are all focused on adolescent health. Since its inception 5 years ago, it has grown immensely with members from 78 countries. This network bridges the gap between the emerging and experienced professionals, fostering continuity and innovation in adolescent health.
Emerging professionals play a key role in healthcare, research, and advocacy. They are on the front lines, caring for adolescents, developing innovative solutions, and pushing for positive change. Yet, they face hurdles, lack of mentorship, barriers for marginalized groups, and at times being reduced to just symbolic representatives without real voice or influence.
Here's our appeal. For a global vision for adolescent health to truly take off, we need national and international leaders to recognize and support these emerging professionals. It is vital to invest in them, provide them with opportunities and mentorship, and tackle the challenges they face. By doing this, we are not only securing a better health outlook for our adolescents, but also fostering a generation of capable professionals ready to lead the charge.
In essence, our collective effort in supporting both adolescents and the emerging professionals dedicated to their well-being is crucial. Together, we can achieve a healthier, brighter future for our adolescents and the world. Thank you.
Hello everyone, this is Göknur Tokçu from Turkey.
And this is Ryan Vieira from Chile.
So today we would like to talk about the problems that we're facing as the young healthcare professionals in the session in our daily lives and how it's affecting us and how these problems can be tackled. So we're in a post-pandemic era, but nevertheless, the influence of the pandemic is still being felt. And Ryan, how do you think the pandemic affected your training?
So in my case, I was in my last 2 years of studying midwifery when the pandemic hit in 2020. So hospitals didn't allow students to go to clinical practice because of COVID, and also units were converted into COVID units, surgeries were postponed, and so on. So I think the pandemic affected my training because we had less clinical hours, less opportunities to practice, and in general, less time spent at hospitals.
Yeah, it was exactly the same situation for us in our OBGYN training too.
I know the workload is challenging for most of us, and especially it's been challenging for the young health professionals. I was wondering, how is your workload in your case?
I do believe in many countries, the young healthcare professionals are facing too much workload and also burnout. And this is to reflect our everyday work, and it's not related to pandemic. I knew it was the same case for the people who were trained before us too, and still is a very important issue. Working hours can go up to more than 24 hours in some cases. And this negatively affects our well-being and also the quality of our training.
I strongly believe the importance of well-being is so underrated, particularly in young health professionals. How can we, as young health care workers, provide care if, for example, if we are stressed, if we are exhausted, if we are burnt out? I believe healthcare institutions, and by this I mean our employers, play a big role in this issue because they need to set a framework for well-being and an environment that takes care of their professionals and also provide their youngest with mentors.
I think the importance of mentorship and support can be also underestimated in many programs, and to have an adequate mentorship is a must, so we can be well-trained and prepare for our future and also decide and build our careers. And in some cases, the number of the mentors might not be enough, or the hours spent on mentorship. And I believe this has to be based on some numbers, some minimums at least, and has to be audited regularly to make sure these requirements are followed.
I completely agree with you. And also, I think it's important that young health professionals are present, for example, at boarding meetings, so that we can be involved in decision making. For this, is imperative that institutions provide that opportunity, for example, by creating a youth-friendly environment. And this is relevant since many countries are currently facing recruitment and retention crisis in the health sector. So I am confident that by incorporating young health professionals in decision-making, governments could engage more young people into healthcare professions and therefore reduce the recruitment and retention crisis.
I couldn't agree more. I hope talking about these important aspects on this platform will improve these problems that the young professionals are facing. And thank you so much, Ryan, for the session.
Thank you so much, Gokner.
Welcome everyone to strengthening capacity and opportunities for young HCPs to advocate for their needs. We have established that young HCPs are vital to adolescent healthcare service delivery. But these young HCPs continually face challenges in their point of service. They include mental health and burnout, like we saw during the COVID, lack of enabling environment to support and promote their growth. In some extreme cases, bad working environments. In some regions of the world, no proper training or research. These challenges are unique to these young HCPs, and they should be given the necessary tools to enable them advocate for their needs. They should be given trainings, and workshops should be organized that will give them advocacy skills. Like some of these trainings are mentioned by my colleague.
Yeah, thank you. Talking about advocacy strategies or talking about trainings that HCPs need to be given, you talk about, first and foremost, you talk about advocacy strategies.
I'll give you.
Under advocacy strategies, a time-tested and very productive form of advocacy is media engagement. You also look at grassroots mobilization. Then pay attention to coalition and network building. Then, of course, there's no advocacy without the whole policy setup. They need to understand the policy framework. Their capacity needs to be well built, sufficiently built, to understand the policy frameworks. And then in understanding policy frameworks, you pay attention to two very important things. You talk about understanding the entire policy landscape itself, okay? And then you also look they must be trained in understanding or identifying policy gaps. There are formulated policies, wide range of formulated policies, to tackle one issue or the other, several issues out there. But where the gap is between formulation and implementation. Okay, implementation, you find that in most countries, there is not so much of policy formulation as it is of policy implementation. So they need to be able to understand gaps, in policies, and it basically touches on policy implementation. And then, of course, effective communication skills. HCPs need to be able to communicate adequately, and then engage on how to get some of their felt needs laid out there for actionable and practical solutions. Yeah.
Oh, very true. Actually, with these skills, they can be able to actively engage policymakers to make evidence-based changes in policies that are vital to their needs. And also, we should talk about social media engagement. They should engage the public to help them understand their needs and give them a stronger backing to their issues, the issues that are being raised. They should also, HCPs should collaborate with each other to come up with a stronger voice when they are making these advocacies. It will be more held, and they will be more heard, and it will be louder. And a lot of policymakers will pay attention to this. So these are
Melis, you're on in less than 20 seconds.
Should be given to these HCPs. And if
I'll give you a 10-second
10 seconds.
10,
8, 7,
6,
5,
4, 3, 2, 1. Melis, it's you.
We will now proceed with our live discussion. My name is Melis, and I'll be moderating this section. And now I would like to extend a very warm welcome to our panelists, Molly, Abraham, Salman, and Ryan. And I also like to thank to our engaged audience for actively participating in our poll. And now together we can review the results. For the first question, I must say I was much more worrisome about the situation, and I'm a little bit relieved with the answers, but still almost 25% of our audience stated that as young or emerging professionals, they lack access to resources and training in adolescent health. For the second question, almost 50% stated that either they, as healthcare professionals, or adolescents for their healthcare professionals, that they don't feel that they're adequately trained in adolescent health and well-being. For the third question, 35% don't feel understood or included in decision-making process of their healthcare. And finally, for the last question, as emerging professionals, the most experienced challenge is experiencing burnout and fatigue for the first one, and for the following with lack of mentorship and guidance from experienced professionals. So all these responses collectively highlight a significant global lack to access to adolescent-friendly services and a sufficiently trained and competent adolescent health workforce. So we need immediate investment in the global training of emerging professionals to ensure equal access to adolescent-friendly services everywhere. So in line with these questions and answers, now I would like to pose 2 questions to our esteemed panelists, and I encourage our audience to share their input in the chat because your insights are very valuable to us. So my first question is, what advice or recommendations would you offer to emerging professionals who are passionate about adolescent health but face barriers such as burnout, lack of mentorship, or limited resources in their respective regions? So Molly, can I start with you there?
Yeah, of course. Thank you, Melis. Great question. I think I'm going to speak a little bit around the mentorship. My first little bit of advice would be to see if there are any local or global organizations or associations within your region. And I said also globally that you could potentially join. Like, we are fortunate within Australia to have the Australian Association for Adolescent Health, and globally we have the International Association for Adolescent Health. And of course, the EPN, which we are members of, the Emerging Professionals Network. And both of these groups do offer leadership and networking opportunities. And also the great thing with this global spread is that each of these organizations have local contacts that you can reach out to. So I think that is a great start, just to see what is around. The other tip kind of around the mentoring, I think, would be, are there any youth events or any youth conferences that you could attend? And can you meet other emerging career people there and reach out? I know some of them come with a cost, but often there will be free events. So again, have a look. And I also think the good question is that, see if you're, especially if you're an early career researcher, get on Google, see if there is an academic or someone more senior that you would like to know more about, and send them a message, send them an email. Most people, in my experience, and as you're witnessing now, love to talk, and they love to share their story and tell you their journey of how they've gotten involved. So I feel like just get that confidence, send that email, or if they're on social media, send them a DM and just reach out. So that is where I'd start, sort of around that mentoring, if you're feeling that you are struggling in that space.
Thank you so much, Molly. All these recommendations are highly important. And now I would like to ask Abraham for his recommendations.
Hello, everybody. Thank you, Molly, for that insightful contribution. Okay, so I would say, starting with first and foremost, that there is need, to prioritize self-care to combat burnout. It is widely believed in most quarters that you cannot give what you do not have. Okay, so it is quite impossible, okay, for the most part, for you to be able to, deliver quality care when you yourself, you are not paying attention to your self-care. It's impossible, practically impossible to give what you don't have. Pay attention to your own self-care too. Pay attention to your mental health. Pay attention to do everything you can to ensure there is no burnout. Okay, because in the long run, your delivery of services will be hampered. Your own life too is put in danger. You are jeopardizing your own life too in the process. And of course, I would also like to add that there is need to learn continually. I mean, all over the world now, due to technology, there are open source learning platforms everywhere, within the international development sector, within the public health specific sector. There are open source learning platforms everywhere, fully funded, paid, free, where you can continually develop more skills in addition to the skills you already have. And so, succinctly put, I would say prioritize self-care to avoid burnout. I mean, recently we heard the news in Lagos State of Nigeria of how a doctor died, from exhaustion, from burnout. And sadly to say, the number will keep increasing if attention is not paid to self-care. And also number two, I would say learn continually, learning, lifelong learning is very important for you to stay alive, not just physically, but mentally and psychologically. Lifelong learning is very important. Keep adding skills and you'll be good to go. Thank you.
Thank you so much for all your suggestions and all your comments. It's really the time to dismantle all the stigma around mental health and well-being, starting with our adolescents and starting with the emerging professionals. So now I would like to proceed with our second question, which is, we're lucky that because all of our panelists are from different organizations in adolescent health, so I'd like to ask, how can global collaborations and partnerships, especially youth or emerging professional-led ones, assist in reducing the inequalities for young professionals in adolescent health? Brian, would you like to answer this question?
Yes, of course, and thank you so much. So I think that global collaborations and partnerships, particularly those led by youth and also emerging professionals, can play a huge and crucial role in reducing inequalities for young professionals in adolescent health. So, for example, I think capacity building is really important. By this, I mean working together and forming partnerships can support capacity building efforts, offering young professionals the chances for training, for developing skills, receiving mentorship, and also advancing in their careers. I strongly believe that this enables them to emerge as more impactful advocates and leaders in the realm of adolescents' health. And the second point, I think it's really important, it's technology and innovation. So usually emerging professionals frequently lead the way in technological progress. Through collaborations, we can also leverage their expertise in digital health, for example, telemedicine and other cutting-edge solutions to enhance adolescents' access to high-quality healthcare. Just in conclusion, I think international collaborations and partnerships, especially those led by youth and emerging professionals, play such a crucial role in driving a positive transformation in adolescent health. I think their distinct viewpoints and vigor and also unwavering commitment can result in different interventions that are more comprehensive, efficient, and enduring. And they're also tailored to meet the specific needs of young professionals in this crucial domain.
Thank you so much, Ryan. Seilman, would you like to comment more?
Oh, thank you, Melis. Good day, everyone. So collaborations, especially those that are youth led, will bring together diverse perspectives, insights and lived experiences of these young professionals. And with that, it will enable us to have, a collective and more holistic understanding of the challenges that are faced in adolescent health. And then when we have that in our toolbox, we can be able to come up with, solutions that are targeted towards policies and towards policies, yes, that resonate with the needs and preferences of youth. And then when we have that, we can be able to come up with a unified voice, to have a more, pronounced advocacy. And we can now advocate for policy changes, we can advocate for implementation of policies, and also we can advocate for them to have resources to be given to us. Thank you.
Thank you so much. And I would like to follow up with that. Although our audience is much more able to access resources in adolescent health, this might be because most emerging professionals or adolescents who can capable of reaching those resources might be able to reach out to these sessions as well. So for those who don't have any access to resources, do you have any recommendations how we can overcome this obstacle? Molly, would you like to comment on this?
Great question. So when the question about no access, so hopefully there's internet connection. Yes. I'm banking there will be an internet connection. I think, again, it's kind of going back when I mentioned about just reaching out around that mentorship opportunity. So, for example, we know, and I come from a research background, that, there's a lot more encouragement for all academic papers to be free for access now. There is a big push for that, which is wonderful. If there is any publications that are behind a paywall, but email the first author. Like 100% or 9 out of 10 times, they will always email a copy or send you a copy. So small things like that, please don't let that be a barrier to wanting to access the latest evidence via research papers. And I think that's a comment from me. I may offer if any of the others want to jump in with any tips as well.
Thank you so much, Molly. And Seylan, would you like to comment as well?
Oh, of course, young professionals should collaborate with their peers so that there will be a form of peer-to-peer, understanding and, sharing of resources. That's my comment on that.
Thank you so much. And there's a question in our Q&A box, and it's about the lacking training specific to adolescent health. The question is from David Rose, and it says, many medical and nursing schools do not include any specific training in adolescent health within their basic training. How can this be changed? So who would like to comment on this? Molly, please go ahead.
Melis, I'm also going to dob you into this question for a response as well. I know you head up our education and training committee, so I'm going to put it back on you. But my quick comment will be, if within your country, within your medical profession, there is no training, advocate for it. Like, go to your university and ask. I know within Australia, my fabulous boss, Professor Susan Sawyer, that's what she did within Australia. She really pushed hard, advocated. She partnered up with the Royal Australian College of Paediatricians to try to get adolescent health into the curriculum. So advocate, and there are organisations like IAAH, that's the role. We are here to champion for you. So think about
Professional organisations take the lead in providing multidisciplinary learning opportunities, foster networking, mentorship and leadership development, prioritise the removal of structural barriers, invest in mentorship and training programs, and engage with early career professionals and young people to ensure their perspectives shape national and global agendas. By fostering these collaborations, you can empower us to become future leaders who can drive progress towards improving adolescent health and well-being, and of course the SDGs.
We call on global leaders to recognize the vital role that young professionals play in adolescent health and well-being as the next generation of leaders. They should provide young professionals and young people with opportunities to meaningfully engage with them, thereby learning leadership skills and the strategies that are necessary for advocating for adolescent health. By so doing, we can accelerate the achievement of the SDGs and also improve adolescent health and well-being, both nationally and globally.
Endorse early career professionals as agents
Stephanie,
of
there's
change
about
in
40
healthcare.
seconds left on this
Healthcare
video.
settings recognize the valuable
35
contributions of
seconds.
early career professionals from multidisciplinary backgrounds who are
Ben,
frontline
Steph is
healthcare
asking if
workers
everyone can
and
be
advocates
repinned
for
to
adolescent
send a
health.
final message. Can you
Provide
go back to
structures
that
that
5-up?
employ young people and early
the
career
6-up, yeah.
professionals and
Yes,
prioritize their
everyone will be
physical and
on
mental health
when we come back
to ensure
for
they
a
can
final
deliver the
message.
best care
Yeah.
for
I'll
young
ask you
people.
for your final message.
Provide
and then I'll
opportunities for
conclude
them
after
to
that.
learn, grow, and collaborate with experienced
10
professionals.
seconds.
10,
Together, we can
9,
improve the health and well-being of
8,
adolescents and bridge the
7,
gap in healthcare
6,
systems.
5,
You want to start, sorry.
4, 3, 2, 1.
Thank you so much. I'm really excited now to give a final word to all of our panelists that we've been able to hear from today. So I'll hand it over to you, Molly, to give your final message for today.
Thank you. Thank you. It's been really amazing hearing this. And I think in summary, I would just say, if you are an early career professional, an emerging professional, just starting, just to say thank you. Thank you for everything you do. I feel like obviously the whole point and why we established the Emerging Professionals Network was really as a chance for us to learn from each other, to advocate for how important we are as stakeholders in the adolescent health and wellbeing landscape. And so, I don't know, just thank you. Like, we hear you, we know there are struggles, and we are certainly trying to advocate on a global and local way to improve this, whether that be through, you know, peer-to-peer learning, of getting to know others, whether it be championing for new education approaches, whether it be for clinical care or for nurses or for whomever it may be. But yeah, I think that's it. Sorry, not really much of a close, just wonderful to be here, and thank you.
Ryan, do you have any final words or thoughts you'd like to share?
Yes, thank you so much, Molly. I agree with everything you just said, and also thank you to everyone who has joined us today. I do believe that in my quest to become a health professional, for me at least, mentorship was a big part of becoming who I am today. So if any, for example, like senior professors are listening right now, please do kind of share that experience, like be a mentor, try to like train your young students or professionals. So yes, I think that would be like my final message. Try to find a mentor who can help you in your career, and also if you are in a position to be a mentor, you know, please do. Thank you so much.
Thank you. That's such an important point. I've had some wonderful mentoring in my career, and I'm very grateful for the people that offer that. So it's so important, I think, as well, to pay that forward as we move ahead in our careers. Abraham, do you have any final words you'd like to share?
Yeah, I think I like how mentorship has been well emphasized, especially by you and the last speaker. I myself am a product of a robust mentorship starting from July 2016 thereabouts, and I also look forward to productively mentoring younger professionals in public health in few days to come, because this is a very vast field if you are with me, and then you need a bigger hand, so to speak, a more experienced hand, to help you navigate the field and be the best you ever aspired to be. So mentorship is key for me. Mentorship is key. Thank you.
I agree very much so. Sale, do you have any final words you'd like to share?
Yes, of course. Thank you, Stephanie. My advice to the young professionals is that they should find peers, their peers, so that they can be able to learn from them. You can't just stand alone. You have to have a community of people. And also, I would like to put out a word to global leaders. They should listen to young professionals, because we are the vital bridge between the adolescents and the, our senior colleagues. Thank you.
Wonderful. Yeah, I definitely agree. The bridge is really important, I think, that we offer. And Melis, do you have any final words you'd like to share?
Thank you so much. And I can say that as an emerging professional, before I joined the International Association for Adolescent Health Emerging Professionals Network, I felt a little bit alone that with the struggles in establishing a formal training in adolescent health, I thought I was alone with my search to reach out to resources. And then through this network, I found the opportunity to collaborate and network with my fellow colleagues. And then I can feel now that I'm not alone. This is very much a global issue, and we can fight together with this. And not only as healthcare professionals, but we're in this with adolescents, with young people, with educators, with teachers and health, other professionals in different areas of adolescent healthcare, policymakers, and everyone. So together, I believe we can fight for this, and we can fight for our rights to achieve to adolescent competent education. We can fight for our rights for our adolescents to access adolescent-friendly services. And together, I think we're going to find a way to do all of this. So thank you for joining us today. It was a privilege for me to talk about these issues together.
Thank you so much, Melis. Well, we still have 10 minutes, so I'm not going to let you all off the hook yet. And we have a few more questions that have come through the Q&A. So hopefully it's okay if I just put you on the spot and ask you each one more question. And I think this one is really important, because I know we have a lot of young people who have joined us today who might be thinking about a career in adolescent health. So one of the questions we have is, how did you come to choose your career in adolescent health? And how can we ensure that other young leaders choose this career in the future? So would anyone like to sort of tackle that question and tell us how they sort of found their path to adolescent health?
I can jump in. I think a role model is extremely important, because it's, for me, I was lucky because in my university, I have my wonderful professors who were role models for me. So although they were alone, because there were only 3 professionals at that time in adolescent medicine throughout my whole country, but they were advocating for an adolescent medicine fellowship program. They were advocating for adolescent health to become in the curriculum of medical schools, and also in residency programs. So far, I think we move along. And I think having a role model, it's just not in your country, but having a global role model and having a mentorship from them is extremely important for someone to be involved in this field.
Molly, I saw you put your hand up before.
Yeah. I applied for a job in adolescent health. So as opposed to my wonderful colleagues who are researchers and clinicians, I'm a project coordinator with a big passion in communication. So that's my role. And I applied for a job working on a project. It was actually the 2016 Lancet Commission on Adolescent Health and Wellbeing. So a wonderful project to join and really fell in love with it. Again, working with amazing people, working within a research organization to hear and see and be around the table to hear the latest conversations of what's happening. Yeah, I don't know, fell into it's the wrong word, but was lucky enough to join. And I've been here, I don't want to say how many years because that may change me from emerging professionals, but I've been here and just really enjoying it. So yeah. So all different pathways. So again, through project coordination and being a research assistant and things like that.
Ryan, how did you find your way to adolescent health?
Well, for me, I studied midwifery, so I always I just felt that it was a way, again, like Molly said, there are different like pathways to get into adolescent health. I do like sexual and reproductive health, and I do believe that for adolescents, it's a really important period in your life. So for me, midwifery is like a pathway for it. And how did I come to choose it? There are these like fairs, like university fairs, where they explain to you like the different careers that you can take in the health sector, and what can you do, where you can work, and which kind of settings will be placed. So again, I strongly agree with Molly that there are different pathways to have a career in adolescent health. There are different health careers. I'm a midwife. My fellow panelists are doctors. So yeah, I think be informed and just be passionate about it. Thank you.
Wonderful. Sale, did you have any thoughts you'd like to share? How did you find your way to adolescent health?
Well, I am an advocate. I advocate for adolescent health, and well, I actually fell in love with policy making. I actually fell in love with advocating for policy implementation, because where I come from, there are a lot of things that do not work. And so I found myself advocating and fighting for, adolescents to be listened to be involved, and to be, cared after. So that was how I found myself here.
And Abraham, did you want to share your journey as well? We might have lost Abraham. So I think I will finish there, and I think that's a really nice place to end as well. And I'd just like to add as well, I found my way into adolescent health, I guess through an unusual path, but I think all of the connections and collaborators of people I've met in this field are some of the nicest people I've met during my career. So I think it's a wonderful place to be if you're thinking about a career in adolescent health. So I'd just like to finish today by thanking again our speakers and our participants for your insights, your experiences, and your recommendations. I think the conversations we've had today really do underscore the importance of engaging, supporting, and empowering our young professionals. It's evident that we have many shared challenges across many regions of the world. So we've discussed potential pathways, strategies, and collaborative efforts. And as we wrap up today, let's take these insights beyond this forum, and we can advocate and implement them in our respective workplaces and organisations. I think let's remember that the health and wellbeing of adolescents are intrinsically tied to how we nurture, guide, and empower our young professionals. So today's forum is not just an end in itself, but it's a beginning, a commitment to fostering diversity, inclusiveness, and collaboration. So with everyone's collective effort, I'm confident that we'll witness a future where young professionals not only bridge these gaps, but also lead the way in advancing adolescent health worldwide. So let's invest in tomorrow by acting today. Thank you so much for joining our session.